Fabio Casahoon, thank you very much. And now to the ongoing effort to provide COVID-19 vaccines here in the Tri-Cities region. Records show that the News Channel 11 viewing area is actually well ahead of Tennessee and Virginia as a whole in percentage of people vaccinated so far. And that may come as a big surprise to those of you who have waited in long lines at health departments and like they did today at BMS, spent a long time also trying to get through on those phone lines at health departments to make an appointment. Yeah, this is video from today as vaccinations began at Bristol Motor Speedway. They ran out about noon. Ballad Health Chief Operating Officer Eric Deaton told News Channel 11's Jeff Keeling that the key has been a relationship between the hospital system and area health departments.
I think the partnership with the health departments both in Virginia and in Tennessee has been very positive, and we talk with them almost daily, and I think getting the vaccine out by coordinating our efforts has really been a positive. That's why I think we're seeing the numbers higher here maybe than other parts of the state.
News Channel 11's Jeff Keeling joins us live once again. Jeff, we've talked a lot about numbers over the past few months, and most of the time it's been pretty grim. Our viewers have let us know they're weary of hearing the numbers, but you're actually coming with some good news today, right?
Yeah, you may want to be sitting down for this one, Josh. Just kidding. I mean, I really couldn't be happier seeing what I'm seeing with these comparative numbers. If you'll pull up graphic 1, let's just sit on that for a minute. So this data comes from the Tennessee and Virginia health departments and also the CDC. If you look at the far left, you'll see that through Monday, Northeast Tennessee had administered vaccines at a rate about 50% higher than the state of Tennessee. At last report, Washington County actually ranked 3rd out of the state's 95 counties.
Sounds positive. How's this compare to Virginia? And I see your numbers there for the rest of the country.
Yeah, you know, more good news, honestly. The CDC site shows Tennessee actually ranks 8th best among the states for administering the vaccine. All these numbers are population adjusted, by the way. So that's why if you look at the U.S. figure, Northeast Tennessee is more than double that. And in Southwest Virginia, the numbers aren't quite as good, but they're better than national averages, and they're more than 50% higher than Virginia's rate.
You know, we're hearing from people who are pretty frustrated about the effort to get a vaccine. They're not feeling like it's going fast enough. Some are accusing the local process of being chaotic. How confident are you that this data is reality?
Well, I am. I mean, every vaccination gets put into a statewide system, but you know, it is a very difficult rollout. I mean, there is a lot of information available, though. If you pull up graphic 2, you can see a screenshot from the Tennessee Department of Health website. That's from this morning. I looked at Carter County, and the information is rolling out in real time. But, you know, phone lines are deluged, and unlike Carter County's situation there where it was limited vaccine message, you can see there that most area counties said no vaccine this morning in their message.
It's definitely encouraging to see our area besting the state and the nation so far. And this really important statistic, you told me some other numbers make it clear the vaccine's result are as critical as ever in our region. Can you give me an example, say from the Tennessee side?
Sure, Josh. You know, I'm looking forward to not having this kind of stuff to report, but the facts are what they are, and you know, it's important to present them. If you look at graphic number 3, it shows the death rates per 100,000 since November. And for Northeast Tennessee and particularly hard-hit Carter County compared to the state, that middle bar shows Northeast Tennessee's rate. It's 50% higher than the state's, and Carter County's is almost 80% higher. And I just saw today there were 4 more deaths there reported today.
Yeah, and I'm guessing trends aren't maybe any better in Southwest Virginia. What are you seeing there?
Unfortunately, no. If you pull up graphic number 4, it's something I noticed I've been following this week. It shows the moving 14-day average of new hospitalizations in Southwest Virginia. That's spiking right now, and it's putting a tremendous strain on the hospital system. I'm just afraid it signals more deaths ahead for a rural area that's reported its 300th death today.
Ballad health departments have said that definitely puts the vaccine's importance into perspective when you see numbers like that. Can you leave us with some encouraging data today? Are you seeing anything out there that's, you know, light at the end of the tunnel stuff?
Let me do that. I was hoping you'd ask. So if we'll pull up graphic 5, it shows comparisons of the number of vaccines administered, that's in blue, and the number of new COVID cases, that's in red, reported in Northeast Tennessee the past 2 weeks. So the right side shows December 20th through the 27th, and you see we just barely got more shots in arms than we had new cases. But look at the week to January 4th, almost 14,000 vaccines administered. That's more than 4 times the number of new confirmed cases.
I like that. Final thoughts as we wrap up.
Well, I'd like to lead with Eric Deaton. He did tell me they're having their hearing supply might start to wane in the next few weeks as vaccine producers or even vendors of syringes and other parts of the supply chain struggle to keep up. So I just encourage people to take these words of Eric Deaton's to heart.
We can see a light at the end of the tunnel, but it's going to be a couple more months before we can get there. And we just ask people to be very careful. This is a deadly disease. We've had over 1,200 deaths already across our region because of this, and it's a real thing.
All right, Jeff Keeling tracking the numbers for us. Jeff, thank you very much for your perspective as always. We appreciate it.
Thanks, Josh.
And you could read Jeff's breakdown all the time on WJHL.com, where he's populating the data for us.